Montréal sans Hep C. It's an initiative with an ambitious goal. It plans to eliminate hepatitis C infections in Montreal by working closely with affected communities in affected communities and tailor support to their needs. Led by Dr. Marina Klein, Research Director of the Division of Infectious Diseases and the Chronic Viral Illness Service at the MUHC, we spoke to her a couple of weeks ago. The initiative has partnered with 16 community organizations to create grassroots interventions tailored to 5 underserved at-risk groups. Now, Scotiabank learned about Montréal Sans Hep C and decided they wanted to help by donating a transformative $1.35 million gift in support of this incredible initiative because hepatitis C can be cured and eliminated. Maria Saros is Vice President and Global Head of Social Impact at Scotiabank, and she joins us now. Thank you for being with us, Maria.
Thank you, Tara. Very happy to be here.
Now, what was it about Dr. Klein's work in eliminating hepatitis C that inspired the leadership at Scotiabank?
Well, I think as you outlined, Dr. Klein and MUHC have an ambitious goal to eradicate Hep C in Montreal, and we saw just tremendous alignment between this effort and our social impact focus that really is demonstrated through our program called Scotia Rise. Scotia Rise is a significant financial commitment the bank has made, $500 million over 10 years, to improve economic resilience. And we do that thinking about sort of the three main drivers that support economic inclusion and prosperity in society. That would be education, supporting newcomers and becoming settled, and removing career barriers for marginalized people. But none of that is possible without health. Like without good health, you can't actually bring people into the path of prosperity. And that's what was, I think, particularly excited about Dr. Klein's work. Because as you know, Hep C in particular affects the most vulnerable citizens in our communities. And that was really what motivated us to support this initiative.
Yeah, this is a really great one. I love the fact, one, that it does support vulnerable communities, and two, that it's actually something that can be cured. So I'm curious about Scotiabank's sort of history in supporting medical research. Has that always been a part of the pillars that you discussed with Scotia Rise?
Yeah, it's a great question. Scotiabank is 190 years old, and so long as we... and so as long as we've had records and corporate history, we have been big supporters of healthcare and health research. We actually have this fantastic physician offering through MD Financial as well. So in addition to providing financial services to physicians, we have this commitment that we've established between MD, ourselves, and the Canadian Medical Association, which is actually oriented towards physician health and well-being. So that's $150 million over 10 years. So we feel really committed and motivated to strengthening health outcomes through Scotia Rise. And I think it really is that nexus between people who are at the fringes and who face significant challenges in equitable access to healthcare. That's really where we think the most meaningful role we have to play vis-a-vis economic resilience and health research.
I know that Dr. Klein and her colleagues working on Montréal Sans Hep C are very excited and grateful about this donation. They're anxious to continue their work. Are you looking forward to seeing, 6 months, a year down the road, however long it takes them to sort of move the project forward, to see what the impact is of a gift of this magnitude from Scotiabank? Are you looking forward to seeing that?
Certainly, and I think there's a couple of aspects to that impact. One is obviously the direct impact, to rid Montreal of Hep C and change the lives of tens of thousands of Montrealers. And I think there's also the broader impact of knowledge transfer and knowledge mobilization that I think will be hugely significant, not only to the province, but also to the country. And that's what I would say is a secondary benefit of supporting a partnership like this, is just what can it do to establish this important institution as a leader in research.
I think that's a really, I'm glad that you brought that up, because I love that aspect too, because what Dr. Klein is doing here in Montreal can be used in other provinces, other countries, all over the world, because this is a problem that certainly affects vulnerable populations. And we know there are a lot of those around the world. Have you had the opportunity to meet Dr. Klein yet? Oh, I believe that's happening soon, isn't it?
It's happening soon, and I can't wait. I'm sure she is incredibly busy, and we have spent quite a bit of time getting to know her team and the MUHC team, and we're just blown away by their level of commitment.
It really is. There. What message would you have for people listening? Obviously, the average person cannot make a donation as transformative as $1.35 million. That's wonderful that the banks are doing it to give back. But what would you say to listeners about making donations of any amount that can contribute?
Yeah, it's a great question. I certainly, large corporations like Scotiabank definitely have a role to play. And when you consider the fact that not everybody in our community has the same opportunity, many of our fellow citizens face systemic barriers. This is a really big imperative for organizations like Scotiabank to step up and say, hey, we're only going to be successful as a financial institution if everybody in our community has the opportunity to prosper and thrive. But at an individual and a personal level, giving is just that. It's very individual and it's very personal. And some of the most moving stories that I hear from our employees who are very passionate about giving back to the community is that they make giving a family affair. They use that time and that opportunity to engage their spouses, their partners, their children around what are the causes they care most about. It sometimes can be a question of values and finding organizations that align to your value set. I think seeing the impact and the effect of your donation in action is so inspiring. And so I would encourage anybody who can give to really make the effort to engage directly with the organization so that they can then see just what these incredible community partners are able to do, oftentimes on very small, limited budgets. That'll fulfill and inspire anybody who decides to give.
That is such a nice answer. That's one of the nice. I ask this question on a regular basis, and I think that's been one of my favorite answers. So thank you for that, Maria. We're speaking with Maria Saros of Scotiabank, and we're talking about a donation that will help eliminate hepatitis C from Montreal. I'm curious to know what your colleagues and staff at Scotiabank feel about this gift in terms of how it's helping to eliminate hepatitis C from Montreal. What have you heard from the people on the floor?
Well, we love the ambition of the promise of eliminating Hep C in Montreal. We also are really excited about the approach that Dr. Klein and her team are taking. Again, it's culturally sensitive. It's bringing care to those communities, taking a mobile approach, really removing a lot of the barriers that many marginalized people face in terms of prescriptions or treatments on the spot. So there's so much that is so exciting. And so when we think about, our primary social impact focus through Scotia Rise, this definitely fulfills a lot of expectations and our hope for a program such as this.
Absolutely. That's great. It's been really a pleasure talking to you, Maria. I find it was a lovely conversation. So thank you for taking the time to come on the show.
Thank you, Tarah.